Us on this beautiful, I always forget. Thank you so much for joining us on this lovely April morning. It is rainy at my house. I don't know if everyone else is getting sprinkled on today, but it is feeling very spring today. It is great to have you all here with us. Today we are presenting the second installment of the 2026 Prevention Skill Builder series. This is a bi-monthly webinar series that focuses on child abuse prevention topics, content, and professional development. Today, we are digging into a messaging, storytelling, and communication topic. So, telling the same story, developing shared messaging around child sexual abuse prevention. My name is Kiki Sergnis. I am the Director of Prevention and Outreach at Missouri Network Against Child Abuse, or MO-NACA for short. And I will let my colleague give her intro too. Feel free, Randy.
Hey guys, I'm Randy Hemme, and I'm the Prevention and Outreach Program Specialist here at Missouri Network Against Child Abuse. Happy to be with you today. If you're wearing blue, take a selfie and put it on social media. That's from our comms person, and that's me. So, trying to really boost our social media with a wear blue today.
Got to get that plug in there. I love it.
Of course.
Um, Absolutely. Okay, so a couple of quick housekeeping things. As you heard and saw just a moment ago, we're recording this session. So the goal is to make these available to folks who aren't able to attend in person, as well as to anyone who might be interested in revisiting the material later. Because we are recording and all the materials will be shared, we won't be admitting AI note takers into the session. So feel free to take a minute and introduce yourselves in the chat. I know we can all see our names on Zoom, but feel free to let folks know who you are, what you do, where you're calling in from. Um, let's see. So this is a 90-minute session. We are scheduled to wrap at 10:30. We do not have a scheduled break. So please feel free to take care of yourself as needed. If you like to have your camera on, that's great. If you'd like to have your camera off, if you need to go back and forth, whatever works for you. And uh, Feel free to use the chat as we go for questions, to add your thoughts. And especially since it looks like we're going to have a smaller group today, feel free to come off of mute and share your questions or your ideas with the group, and hopefully we can get into a robust conversation. Amazing. So glad to have you all here today. Good showing from Springfield CAC. Good to see you all. Excellent. Kappa Cares, St. Louis Public Schools. Good morning, everyone. All right. So, as I mentioned, this is the second session of our webinar series. Every other month, we will meet on the second Friday on Zoom. For these webinars, our topics alternate between school-based topics and community-based prevention topics. So in June, we're moving back to school-based. We're going to be focusing on relationship building and communication with school partners. August, we'll be navigating tough questions and challenging conversations. That one will be presented in collaboration with Stephanie Knoll from the St. Louis Anti-Violence Project. In October, we're going to be digging into hotspot mapping for safer schools. And then in December, back out into the community, looking at community asset mapping. So bringing those tools, zooming out with some of those tools. So before we get into the nitty gritty of the training, I'm curious. What are some of the most common challenges that you all are running into when you are communicating, whether it's within your organization, in your social circle, out in the community for work, about child abuse prevention? Feel free to write in the chat or to come off of mute and share.
I think a struggle we always have is getting people to show up when we schedule trainings. So
Hmm.
if I don't know if we would have an issue communicating it once they got there, but just getting people to show up for the conversations if it's a training based. And then I think just having conversations with like family and stuff for me is they all kind of have a limit of how much they want to hear.
Hmm.
So obviously, I'm not talking about cases. I'm in prevention, so I don't know much
Sure.
about cases anyway. But then I'm also legally not going to be sharing information. But um, I just think there's that limit of how much people want to hear in a just casual conversation.
Absolutely. And Jamie, I just want to validate, I think in both of those places, sometimes people aren't showing up because they're right at like they've kind of reached a limit too. Um, but when they're not there, we don't know. So it's hard to know and it's easy to extrapolate like, oh, they must not care about this or they must not be interested. Um,
And I know a lot of it is time. Everyone's busy. You know, we could do a training during the day, we could do it in the evening, we could do it at midnight, and people are
mhm.
still gonna be like, "Oh, that doesn't work for me." So I do get that, but like we had a legislative update yesterday in Springfield that our boss Nicole went to, and she said there were probably a couple hundred people there to
Wow.
listen from legislators talking about money and where the money was going and how schools were going to be funded. And I'm like, okay, but we can't even get 10 people to show up to talk about how to protect children. Like, come on, people,
Mm,
it's that frustrating bit. But
absolutely. It is frustrating and it really can be. And something I want to share that a colleague shared with me actually is she said, people, especially when you're hosting an event that's, pre-planned and you get a lot of people signed up, right? And then you don't see people in seats, right? Or people log in on the day of. Something that she told me is that people sign up for one reason, right? Because they're interested and they want to learn. People don't make it for a million other reasons. So sometimes I think that was something that I think was like a helpful nugget for me to hold on to, right? Like they might not come because they got sick or because their kid got sick or because they had got a flat tire or because it's raining and they don't like driving. Like there are a million reasons, right? But they signed up because they care. And so something that colleague was saying was maybe that's a better measure of how interested people are versus how much they show up. And I think it's hard because we don't get to talk to them unless they show up. um, so there's a big barrier there, but it's helpful to know at least there's that connection that happened. Um, so not to minimize what you were saying, Jamie, because I think everybody probably in this conversation can relate to like putting in the time and energy to try to outreach to folks, to try to engage with people about a really meaningful topic, and then to have it kind of be crickets, nobody in the seats or people aren't engaging. Um, Other things I'm seeing. So Lindsay agreed, said yes, attendance and getting people on the same page. Bo Ann said openness to learn can be a challenge. Yeah. I think this is something that we've probably all encountered too, is that people come in thinking that they know what they need to know, right? Um, they already know the story. And um, sometimes they're there because they're hoping that what you're saying is going to align with the story that they're holding. Sometimes um, they're there because they think it's not going to. And occasionally, sometimes they're there to disagree, right? Yeah. Any other things that pop up? Other challenges?
I'd say one would be like sometimes just not hearing us, so then they'll just hear child abuse and then it's automatically, oh, children's division kind of route rather than like all the other, organizations and things. So sometimes that can be a barrier because then they're just automatically thinking children's division and like you're a caseworker there and they go down that route. So that could be challenging.
Yeah. I think especially for folks who don't work in this field or haven't maybe worked in social services and maybe aren't plugged into or tapped into kind of that larger ecosystem, we kind of collapse everything together, right? And people rely a lot on stereotypes and assumptions and the stories that they've heard from the people in their lives. Like if someone's talking about child abuse, they must be talking about hotlines, or they must be talking about removing kids from homes or something like that. Yeah. One that I will share, and this will come up later in the training, so this won't be a total surprise, but I think one of the challenges that's really hard for me is when folks are coming in thinking they already know a story, right? They know the story about child abuse, and that this is inevitable. It's really a shame that it happens, but I don't like, what do you mean prevention? We just have to punish people after they've harmed someone. And I think it really kind of sucks all of the air, all the wind out of your sails, right? When you're trying to do prevention, when you're trying to build up some momentum and energy in your community around prevention, when folks are either so burned out and in survival mode that it's really hard for them to think about that have that long-term vision and foresight, or when they're like, man, I've seen a lot of bad stuff and I just don't think that we can get out in front of this. There are lots of reasons. Those are just two, but I think those are from. Well, feel free to keep adding your thoughts in the chat. I'm going to keep us moving. But I appreciate hearing from folks about what some of these challenges and barriers are. And I think this is going to be a common thread through the conversation. So if you have been to a training, or I guess even had a conversation, right, that I've been in before, you've probably heard me say this because I feel like I say it 100 times a day and my family is sick of hearing it. But I think especially in this work, when we're working to minimize harm that's happening right now, right? Keep kids safe right now, and to create infrastructure to work toward building out a world where kids are safe all the time. We have to hold two like nuanced, complex truths at the same time, right? We need urgently to take care of and the people who are not safe right now. And we really have to work hard to change the conditions in our communities and in our society and our culture that are perpetuating these cycles of abuse and violence, right? So you're going to see me doing this a lot, holding these two things at the same time. And I encourage you to do that too, right? You don't have to agree with all the things that you're holding. Just try them on and see how they feel, and see what they feel like in your hands, or what they feel like in your heart, or on your tongue. So two of the truths that I'm thinking about right now is that in Missouri, we're really fortunate that we have people around the state, right, who care deeply about preventing child abuse and child sexual abuse and are trying to move the needle. And also, we are really spread out, right? We don't have the resources to have huge communities of preventionists all over the state, right? In most of our cities and communities. A lot of us wear a lot of hats, right? And by that, I mean, many of us are not exclusively talking about prevention in our work roles, right? We might also be doing some advocacy. We might also be doing some outreach and communication. We might also be doing some marketing or strategic planning, or helping with forensic interviewing, or doing crisis intervention and response. Like, we're probably doing a lot of things at the same time. And that often means that we get stuck in response mode, and we end up doing things and saying things differently because we don't have the time, the energy, or the space as a statewide network to come together and say, how are we going to have these conversations? Right? Our communities need different things, but we can agree on the basics. One of the other complex truths that we're holding at the same time is that people who work in the field of child advocacy and child welfare and child abuse prevention, we are really passionate about our work. Some of us stumbled into the work, like we didn't set out on this path, right? But most of us are not doing it because we're like, it pays the bills, right? Because let's be honest, sometimes it's not paying all the bills, right? But we also a lot of us come to this work because we have personal connections or experiences, right? In the field of abuse or trauma or violence, right? We've been impacted in some way. The flip side of that, right, that can sometimes create a barrier or a challenge is that urgency and sometimes our really intense enthusiasm can sometimes act as almost like blinders that keep us from seeing other ways that people might need opportunities to come into the work or on ramps that look a little bit different than the ones that we are in, right? How many of you all have ended up in a conversation with somebody where they're talking about the thing that they care about the most, and it's a thing that is not the thing that you care about the most, right? This could be a kid. This is like how I feel when my nephew is like describing what's happening in Minecraft to me. I'm like, you care so deeply about this. This matters to you a lot. And I have no idea what you're talking about, right? I want to support you, but I am like a little turned off. So when he says, "Do you want to play with me now?" I'm like, I'll just watch, right? So sometimes, right, that urgency can almost get in our way. So those are two of those sort of complex challenges. We talked about a lot of them. We talked about people's time and energy is limited, right? And so when we want people to come to us to learn, there are lots of other things that they have to fight through to get there first, right? When we are hoping people will come with an open mind and an open heart to dig into the conversation and the information, we know that they're dragging a lot of baggage with them, right? And that baggage could be their personal experiences, that could be stereotypes about child welfare or about families who are involved in the child welfare system or whatever that is, right? Or bringing a lot with us. So for this conversation, after having a number of chats with folks all around the state who were like, I wish we don't need a playbook, we don't need a script, right? We don't need to all be saying the exact same words in the exact same way, in the exact same pattern, right? We're not putting on a play, we're doing choreography. It can look a little bit different. But what are the messages and the values that we all can hold in common that we can start from to open up these conversations? So this was a really like back to basics question and moment for us. So when I worked with young people, when I worked with high school kids, and we would do violence prevention campaigns in their schools and in their communities, we were planning, I would always ask them these three questions, right? Okay, we have this goal of putting on this event or doing this campaign. What do you want people to feel? What do you want people to learn? And then what do you want them to do about it? So I put myself in their shoes and I walked myself through those questions, right? When we're talking about prevention, what do we want community members to feel, learn, and do? So I did this exercise, and your thoughts might come out super different about how you want people to feel, what you want them to learn, what you want them to do about it. So feel free to write yours in the chat, because I'm just going to share kind of where we came from. We wanted people to feel included in the movement, right? Feel like they have a space, that they can do something, and that they are prepared to take meaningful action, right? Because we know if people don't feel like there's a role for them and they don't feel prepared, they're either not going to do anything or they're going to do something that might be counterproductive. I wanted people to learn basic information, right, about the dynamics of child abuse. They don't need to know every data point. They don't need to be experts, right? But there are some basic pieces of information that people really need to know and understand to be able to take that meaningful action, right? If we're all still working from the stranger danger story that we learned when we were kids, right, people are not going to be prepared to take meaningful action. That's going to keep kids safe. And then we also want people to learn, right, what a healthy and supportive culture that prevents violence looks like. Because we all know what the world that doesn't prevent violence looks like, because we live in it, right? We all know what a world where people don't have equal access to opportunities looks like. We all know what the world where children, right, tend to be at the bottom of the ladder all the time, right? We already know what that world looks like because we live in it. But we need to understand what it could look like to live in a world where we prioritize safety and healing and prevention and connection. And then, right, how are they feeling? What do they know now? What do they do about it? So we want people to take pro-social actions that model healthy boundaries for children and adults, right? That's like really one-to-one. This is how we want them to show up in those relationships. We want them to speak up when boundaries are violated, right? That's another step up, right? We're kind of scaffolding. And then to take a public stance, right? To be outspoken and to be an identifiable prevention advocate, right? That doesn't mean you have to walk around with like a sandwich board on that says Child Abuse Prevention Month or whatever, but it means people in your circles know that you are a person, right, who values the role of these preventative actions and doesn't condone abuse and boundary violation and things like that, right? So when people say, wow, I heard about this wild thing that happened, I'm not sure what happened or how I feel about it, they know, okay, I can go talk to Thomas about this, right? Or I can talk to Lily about this because I know that in my social circle, they are people, right, who are advocates for prevention and understand the dynamics. And they have I've seen them take pro-social actions. I have seen them speak up. I know that they are someone in my social circle or in my community that has taken a public stance, a pro-prevention public stance. Is this tracking for folks? Okay. So coming out of that, there were these 4 big themes that stood out to me, right? Empowering, inclusive, actionable, and impactful. So empowering, we want the messages to be empowering because we want every community member to have the information and the skills that they need to make an impact, both at an individual level and then at a bigger community level, right? Empowered to use the information and skills to put them into action, right? To put that feel, learn, do into action. Inclusive, messaging that's inclusive, that shows that every community member has a role to play and can see where they fit into the movement, right? And when I say the movement, I mean child abuse prevention. Actionable messaging, right? So showing people that there are clear and practical steps that every community member can take, including smaller steps, right, that can lead to larger transformational change. And then lastly, we want these messages to be impactful, right? So that when we're showing people what kinds of actions they can take, they are seeing examples of actions that are practical and that can make an impact on people around them and in their community. The effect of these actions will be magnified as more people engage. So this is what we're hoping for. So from this place, looked at how do we boil this down into clear, concise messages that we can all share in all of our roles and all of our communities and all of our spaces. And so what came out of that were these 4 core prevention messages, right? Child sexual abuse happens in every community. Child sexual abuse is preventable. Adults are responsible for preventing child sexual abuse. And then here's the heavy lift, right? Preventing child sexual abuse requires changing our behaviors, our mindsets, and our environments. There's a lot in that last one, right? We're going to unpack all of this. We're going to talk about these and how they kind of scaffold. and where these messages come from. Thoughts or questions before we continue? Okay. So these core prevention models are supported, right, and built out of 3 models or frameworks. And I'm going to touch on these for you really quickly so we can kind of understand the role of these in messaging and in kind of norms, like positive norms change. But there will not be a quiz or anything like that, of course. So the first one is the HOPE framework. This was something that was developed by Dr. Chan Hellman at the University of Oklahoma. And so Dr. Hellman specifically, he's a psychologist, and he studied the impact of hope on outcomes, on like our outcomes as service recipients and clients, our outcomes in the workplace, and our outcomes as communities. So what Dr. Hellman found is that when people feel and hold hope, which he defines as the belief that your future will be better than today, and very importantly, that you as an individual have the power to make it so, when people hold this belief, they have more success in treatment outcomes and treatment plans, right? Or in terms of achieving non-clinical goals than they do if they are gritting their teeth and going through the motions, right? And that probably tracks and maybe feels like a no-brainer for you. But let's break down what these components of hope are that Dr. Hellman talks about. So he says that there are 3 components of hope. That hope has a goal, right? A goal setting, right? That helps identify what you want that future to look like. That there are pathways, right? He identifies pathways as the ability to identify, oh, and I'm seeing a typo now, routes toward the goals, and to find new goals around obstacles when they come up. So problem solve on your way there. And then willpower, which he describes as the mental energy or agency required to pursue and endure those pathways, right? To keep going, to persevere through barriers, right? And you could pull all these things out. We could talk a lot about motivation. We could talk a lot about these pieces, but we know that we need a goal, a way to get there, and the energy and support, right, to follow the path. The second model that we came to when pulling together these core prevention beliefs is the trans-theoretical model of behavior change, or you also probably have heard this called the stages of change. This one has been around for a while. If you have studied mental health or substance use or public health or any of these things, you've probably heard about the stages of change. So this is probably going to look familiar, right? The idea behind the stages of change or the trans-theoretical model is that it understands and really acknowledges that there are both external and internal obstacles when it comes to achieving behavior change. So when we're talking about any kind of behavior change, right? Whatever your role is, you might be talking about things like somebody who wants to quit smoking, right? We're talking about behavior change toward these prevention strategies, right? So it offers a more compassionate lens to support people who are struggling toward a behavioral change. So the stages of change, there are these 5 key stages of change. Pre-contemplation, not thinking about or aware that there's a change that needs to happen, right? This is before I know, when I'm just like, man, I'm tired all the time, right? But I'm not thinking about like, should I go to sleep earlier? Should I change some habits? Things like that, right? Contemplation, which is when you start to realize there is a problem, but I'm not sure what to do about it, or I'm not sure if I want to do something about it yet. So that's me saying, hey, I'm really tired, but also the new episode of my show came out last night, so I need to stay up and watch it, right? I know there's a problem, but I'm not ready to do anything about it. Step 3 is preparation, or stage 3 is preparation, which is getting ready to change, right? It's that feeling of, I know that we have to do something about this. What should I do, or what can I do? Then comes action, which is the stage where folks are actively taking steps to change the behavior. And they could use any number of different strategies or methods. The last stage of change typically is called maintenance, right? So this is when people are continuing the behavior change, demonstrating long-term commitment to that behavior. When some folks talk about this model, they don't include relapse, but I think it's important to include relapse because behavior change, like most things that human beings do, is not a linear process. Often when we talk about relapse, we're talking about it in the context of things like substance use or compulsive behavior, right? But I think that relapse happens in all sorts of these settings, right? So relapse just means returning to old behaviors, right? So that might mean, okay, I've been doing a great job of sticking to my sleep schedule and my sleep hygiene plan and all of this stuff. And then I get an opportunity to go to a concert or whatever, and I stay out all night and I just totally blow up my plan. That would be relapse. It's harder to get back into the process after you have dropped the habit. So then the last theory that I want to talk about is the community readiness model. So the community readiness model is adapted from the stages of change for larger scale behavioral change. So really this is looking at community changes or adoption of a new process or adoption of a new policy in a community. So the community readiness model, similarly to the trans theoretical model, understands and acknowledges that, you know, there are obstacles in change processes, both at the individual level and at the community level. But this one really looks at the importance of influential or powerful people, right? Do we have buy-in? Are we feeling resistance from that person? And emphasizes the importance of that buy-in or resistance in the process of change. So really briefly, let's look at this one. So you'll notice a lot of similarities between the stages in the community readiness model and the stages of individual behavioral change. So it starts with no awareness. The community doesn't really see this thing as a problem or a concern, and there's minimal knowledge of efforts to address the issue, right? That might look like there's always trash around in my neighborhood. That's just kind of how it is. It's not really a littering thing, there's just trash around. Denial or resistance. So community members have misconceptions, or maybe they have incorrect information. And there's minimal support, maybe a little support to utilize resources to address the challenge, right? So this is kind of where people are like, no, this isn't a big deal. Everyone is blowing this thing out of proportion. There's trash everywhere. Every community, every neighborhood deals with this. It's not a big deal. Vague awareness happens when a few leaders and some community members start to become aware of a local effort, if it exists, to address the issue, but don't really know a whole lot about what needs to happen. And then we get into pre-planning, right? People are beginning to acknowledge the issue, but they may not know what to do about it. This is where things stop in a lot of communities, right? This is a problem. We don't know what to do about it. So we get kind of stuck, right? And we kind of spin our wheels, and then we maybe fall back into vague awareness or denial, but a lot of people are hanging out in this really like 2 through 4 area. Preparation comes from people learning more, becoming more aware of what they can do and how to utilize resources to address this issue, things like that, right? People might be doing some research. They might be talking to other communities who have addressed this issue. They might be trying to figure out what's going to work for us here. Stage six is initiation, which is just what it sounds like, right? People are starting, right? Ownership has been taken, there's been some responsibility that's been defined, and people are beginning to take minimal steps, right? Maybe they allocated some resources, they wrote a grant, they did something, and they're taking steps. Stabilization means that there has been a significant uptick, right? There's more community ownership of the issue. It's growing and developing. More people know what's going on, even if they're not involved. Expansion and confirmation is a demonstration of the community's commitment to the issue, right? Maybe they vote and pass an ordinance. Maybe they hold a big event or a rally, or we were talking about littering. Maybe there's a community-wide pickup and tons of people show up. Like, we're seeing these really big upticks in the kind of like people resources, the financial resources, the time resources that are going into addressing the issue. And then lastly is community ownership, right? Where community members and leaders within the community expect efforts to be ongoing and see them as an important work of their community. This becomes normalized. This is a process, right? Now this is a part of our routine. This is a part of our process. This is a part of our design, right? We've built in this intervention into the way that our community operates. So that's a lot of theory, right? That I just dumped on you guys. It's a Friday. It's not even 10 a.m. Nobody signed up for my class, right? You didn't know there was homework. Why are we talking about this? Why use this? Why not just tell people what we want to tell them, right? And I think what gets missed sometimes when we're just like telling people what we want to tell them is that we lose the opportunity to build trust. And that's not to say that that we are doing that. That is to say that as a field, right, and kind of as a country, we're struggling in this place, right, where people have lost a lot of trust in the messengers that they have gone to in the past, right? We're seeing this at a lot of levels. We're seeing this in the federal government. We're seeing this in our local communities. We're seeing it in people that we know, right? Excuse me. Excuse me. We know, wow, that trust, sorry guys, that trust matters for a lot of reasons, right? We already know that trust matters. That's probably something that is important to a lot of us. But when we're talking about large scale communication, trust matters because it is the foundation for collective action and infrastructure. If people don't trust the information that they're receiving or the messenger that is delivering it to them, they are not going to buy it. Right? We're going to get stuck at feel and never move into learn or do. Trust in our current kind of landscape. Gosh. Trust allows for people to hear and pay attention to and consider, right, the information that we're offering and sharing, despite what is often a very noisy, fragmented, saturated information environment. We are all getting information thrown at us all the time, right? On the news, on social media, from the people around us, on our phones. Even if you don't use social media, you are getting so much information thrown at you. Some of it is maybe filtered through what feel like credible sources. Some of it isn't, right? And so we need to build trust to create a space for folks to hear us. And then lastly, without trust, even really credible, well-researched, evidence-based information, right, or recommendations are often misinterpreted, right? As like, well, why do you feel so strongly about this? Why are you trying to push this on me, right? A lot of folks might interpret that as there being some kind of agenda. especially if they are holding a worldview or they are thinking or expecting there to be hidden agendas or there to be stories that you're not telling up front, that you're not being transparent about. If you're, excuse me, if you're interested in learning more about trust and communication, I can't recommend enough the Frameworks Institute. They have some really incredible resources. Some of these trust pieces came from some of their materials and trainings. They do an incredible job of talking about communication, messaging, and how to talk to audiences who might be coming in with blockages. So we talked about why trust is important, but in order to build trust meaningfully and in a genuine way, we have to understand the barriers that people face that are preventing them from taking action. We were talking about some of them, right? We were talking about openness to learn. We were talking about getting people to participate in events. We were talking about the stories or the experiences or the biases that people are coming into the conversation with, right? And so we have to take into consideration that folks are encountering these barriers. So let's flip back to our trans theoretical model for just a second, right? It was these 5 stages plus relapse. So let's talk a little bit about how this might show up in the context that we're in, right? We're finally getting back to talking about child abuse prevention. Finally, I promised I would get back there. So let's talk a little bit about how this translates, right, into our core prevention beliefs. At the pre-contemplation phase, this is when folks do not know about the issue, do not understand why it's important, do not think of the prevalence, right? These are the folks who might say, well, that would never happen here, or that only happens to kids who do X, Y, and Z, or that would only happen in a family that's different than my family, or that would only happen in a community that's not like my family, right? These are the places where we're dragging a lot of like denial or misconception, or some of those outdated stories, like those stranger danger stories, right? For example, with us. So moving someone from pre-contemplation to contemplation, we have to tap into the universality of the issue, right? So actually, this is a place where we validate, I hear that all the time. And actually, the data that we know, if they're a data person, there's lots of stories, there's lots of ways that we can pull this in. A lot of people are really surprised when they find out that child sexual abuse happens in every community. I know, right? You can validate. I couldn't believe it either, right? Or whatever it is. Or it's really hard to think about because we don't want to think about that many kids being hurt. We don't want to think about kids close to us being hurt. We don't there are ways around these barriers, right? So we move from laying a very basic foundation, right? Contemplation, someone is more aware of the issue, but they do not yet have the understanding or the tools or the capacity to know what to do about it. So they're probably sitting in that space of, wow, child sexual abuse happens in every community. That is overwhelming. That might feel scary. That might feel upsetting. That might feel distressing. And the good news is that child sexual abuse is preventable. Okay, this is new information. I'm taking this in. This is part of my preparation phase as I move through these stages of change. Okay, so I know that there's something that I can do because we're talking about prevention. We're talking about that abuse is preventable. So I'm not ready yet in that preparation stage to know exactly what I'm going to do, right? Or how to do it. But I'm getting to a place where I understand that we can do something about this, that it is not inevitable. That is an empowering change. That is a shift toward action that happens. Okay, so moving into my action stage, now I have the opportunity to hear that adults have the responsibility to prevent child sexual abuse. And people can hear that in many different ways. They might say, oh man, that feels like a lot of pressure on me. And I'm just learning this. I didn't know this. I just found out, right? They might say, oh, what a relief. I was worried that we were expecting kids to take care of this by themselves, right? They might feel a lot of different ways about this. They might feel curious. Well, how can adults do that? I didn't know that. I was always taught that if someone touches a kid, the kid should go and tell a safe adult, and that's what they should do. That feels like a very child-focused intervention, right? There are other things that adults can do too. Okay, I'm open. I'm curious to learn more. Or maybe I need to hang out in this space more and grapple with the idea that I have a responsibility that I maybe didn't know about until right now. And maybe that means I'm feeling a little bit of overwhelm or guilt, right? That I didn't know that this was my responsibility before. And that maybe there were actions I could have or should have taken. Let's not say should have, could have taken, right? Might have taken in the past, but I didn't know that that was my role. Oof, that's a lot to hold too, right? So at the same time that folks are going through this like process of learning and ideally feeling empowered and feeling more prepared and included, they might also be feeling having like a parallel emotional process, right? That feels like heavy or sad or confused or guilty. And then we move into the maintenance stage, which is where the habits take root, which is where the new behavioral patterns happen, right? So when we learn that preventing child abuse requires changing our behaviors, mindsets, and environments, that gives us the opportunity to say, okay, there are changes that I can make at all of those levels. Maybe I have to start small because I'm just learning this and this is new to me, but I can scaffold and I can step up to these higher impact and higher level prevention actions in the environments that I spend my time in once I can work on my individual behaviors. And then I also want to acknowledge relapse, right? I mentioned earlier in the stages of change, if we're being really positive and strengths-based, we might not want to talk about relapse all the time. But it's really important to remember that it happens. And I think in this space, right, a lot of the time relapse looks like overwhelm or burnout. And I bet that all of us on here have dealt with that, have dealt with feelings of overwhelm or burnout related to the work that we do to prevent child abuse and to protect kids. There are times when it just feels overwhelming, right? Which is when we kind of put down some of those proactive prevention beliefs, right? Or we have to take a break from them for a moment to feel the sheer overwhelm of the scale of the issue, right? There might be a case, there might be a conversation, there might be a disclosure that you receive. It might be that I'm really comfortable doing this in my professional life, and then when these issues enter up into my personal world, that's where it becomes really overwhelming, right? Um, it feels like doing this work should shield the people closest to us from these issues. And really, sadly and unfortunately, that is often not how it works. So there are lots of ways that relapse might show up in our own or the people around us in our stages of change. I also just want to acknowledge that because this is not linear, relapse also often puts you back into your action phase after or your preparation phase, right? Might need to go a little slow, but that's okay. It's not the end of the road. This is a nonlinear path. So let's talk a little bit about these messages. The stages of change, all the pieces of the conversation that we've been having so far, and how these things can help us prevent violence. Okay, because we've been talking about kind of abstract stuff so far. So we're going to dig into risk and protective factors for a moment. I am guessing that most of us on this call have heard about and learned about risk or had conversations about risk and protective factors before, but just to level set, just to get all of us on the same page, really basic kind of explanation or definition. Risk factors are characteristics or events that increase the likelihood of negative outcomes, right? These are things we've all heard, right? People who smoke, smoking is a risk factor for respiratory illnesses, right? That's something we've probably heard, right? And so we would say protective factors, right, would be avoiding secondhand smoke, quitting smoking, smoking cessation, right? Would be harm reduction, right? People who transition from smoking cigarettes to using like a vape, right? A nicotine vape, something like that, right? We're talking about how people can buffer against those risk factors or against those outcomes. So protective factors are characteristics or events that decrease the likelihood of negative outcomes, and that specifically also promote positive outcomes, right? It's not just minimizing the bad stuff; they also actively improve circumstances in our health and outcomes, our health and well-being. So when we talk a little bit about the personal work, right, of prevention, the part where I say, okay, preventing child abuse requires us to change our behaviors, our mindsets, and our environments. We're going to focus in first on the personal work, right, the behaviors and the mindsets. So we're going to take a couple of minutes and talk about how we can address individual and relationship level risk and protective factors through behavior change and mindset change. We tracking? Okay. Because they're probably like, she's taking us on such a winding path. Where are we going and how are we getting back to the finish line? We'll get there eventually. I promise. So feel free to drop things in the chat or to come off of mute and share. What individual or relational, right? So like kind of one-to-one or very small group risk factors perpetuate or increase child sexual abuse? And this specifically is framed as perpetration, right? But you can think about it in terms of vulnerability to victimization as well, if it feels tricky to tackle from a perpetration lens. What are the risk factors that increase child abuse?
Not having safe adults or adults that can create clear boundaries for themselves or children.
Absolutely. Thank you, Emily. Thanks for getting us started. Oh, and I saw Lynn in the chat also said lack of education about body autonomy and consent. Lack of adult supervision. Jamie said maybe someone who feels lack of control in their life somewhere. So it sounds like, yeah, that one definitely feels linked to like that perpetration risk factor. Family history of sexual abuse. Absolutely. Thank you, Kiara. Absolutely. Feel free to drop. Yeah. Oh, yeah, you guys are coming in with some solid, these are great answers. Limited impulse control, absolutely. Impulsive behaviors, we definitely see that as a potential risk factor. Feel free to keep adding stuff. I'm going to just toss a couple on the screen too, right? So the very first one on there, somebody mentioned, oh, family history. Yes, so prior victimization or perpetration, right? Exposure to sexually explicit media, poor impulse control, substance use, lack of empathy or concern for others, aggressive behaviors, and acceptance of violent behaviors. And then in some of those relational, right, spaces, oh, we got this one in the chat too, family history of conflict and violence, childhood history of abuse, poor parent-child relationships. I think someone mentioned this one earlier. And well, I guess Emily, you had thought, you didn't specifically say parent-child, but you said lack of support from trusted adults, right? Which would absolutely fall into that category. Exposure to highly sexualized environments, social isolation or exclusion, especially from peers, and then association with sexually aggressive, hypermasculine, or antisocial peers. So we see that a lot of these risk factors, the ones that you all named, these are also probably things that are showing up in other spaces too, not just when it comes to perpetration of child sexual abuse, right? Especially for folks who are working with young people, right? Things like conflict in the home environment or the family environment, things like lack of supervision and support from a trusted adult, impulse control, prior victimization. These are going to show up in the work that you're doing with kids in other spaces as well, right? So we know that a lot of these risk factors and protective factors are really linked, right? It's not just like these only play a role in in sexual abuse. We see these risk factors interconnected and overlapped with a lot of childhood adversity and trauma experiences. So let's flip the script a little bit and talk about some of the take a strengths lens here. What would you say are some of the protective factors that prevent or reduce or buffer against abuse? Feel free to throw them in the chat or come off of mute.
I would say in both from a perpetrator and a child perspective, having that one safe, trusted person that you feel like you can talk to as a child experiencing it, but also as somebody who's maybe having those thoughts or urges.
Yes, absolutely. I think that's a really important place to start, Jamie, because I'm sure that most of you guys, again, have heard this or seen this research, right? But there's there's a lot of research out there about adverse childhood experiences and trauma and resilience, right? And a really important finding is that the presence, right, and a relationship with a stable, trusted, reliable adult is the number one protective factor for resilience after experiencing childhood trauma. Absolutely. Yes. And then Bowen is saying the same thing, quality relationships with parents or caregivers, right? So checking in, having conversations, setting examples, having that open line of communication, feeling supported. Absolutely. Feel free to throw some other things out here. I'm going to put a few on here. And these really line up with what you all were saying too, right? Emotional health and connectedness, empathy and concern for how for other people, for how one's actions affect other people, education about healthy relationships and sexual development. I think this is kind of the flip side of what Lynn offered in the chat a minute ago. Success in school or meaningful activities. That's kind of a connection, right, to something external. And then here this is exactly what we're talking about, all of those relational pieces, right? Emotional support from a trusted, reliable adult, families where caregivers work through conflicts peacefully. I love that example setting message that Boanne had mentioned. And then healthy peer relationships. So these individual and relational level risk and protective factors, these are the pieces that show up a lot in our behaviors and mindsets, right? So I'm going to be cheesy and borrow this iceberg image for a second. I'm sure that you all have seen the movie Titanic, so you know what kind of damage icebergs can do. And the thing about them that makes them so dangerous is that such a small part of them is what's visible, right? You think, oh, that's just a little chunk of ice floating out there, when actually it's this massive structure under the surface that goes really deep and is really big, right? So shout out to icebergs for being the perfect metaphor for talking about these things, right? So when we talk about behaviors, right, and behaviors being the ways that we interact with each other, the observables, right, the ways that we interact with individuals and institutions and groups, that we respond to information and that we show up in situations, right? That is really the tip of the iceberg for us. And I think, going back to that conversation that we were having about childhood adversity and trauma, I think all of us, and I'm guessing that everyone on this call, right, has been in conversations, has been in trainings, has been in spaces where people are really working to be trauma informed, right? And shift from that, like, what's wrong with you? Why are you doing that? To like the what happened that's causing this, right? And I think that's really a well-worn path at this point, at least that example. But the behaviors have us really stuck in that what are you doing? What's wrong with you place, right? um, because a lot of us, right, our brains are so overwhelmed with information, with responsibility, with things that we have to know and think about and do, that we are taking shortcuts. Our brains are taking shortcuts as often as we can. So we are often relying on those behaviors to tell us what's going on, right? I saw them do this, so they must be doing X, Y, and Z, right? I saw them do this, so they must care about this, right? Or I'm thinking about, not to put you on the spot, Jamie, but your example earlier about, I'm trying to offer a training or a workshop or an event in my community to educate and inform people, and nobody showed up. So my assumption based on that behavior is that nobody in my community cares about child abuse, right? And that's really going to affect the way that I show up in these other community spaces. Versus if I say, man, that was really frustrating because this took a lot of time to plan and we were really hoping to get some people here. And, we spent money on the food and the whole thing. And it's really rough out here that nobody can make it to an event on a weeknight. Like, how tough must things be going for people, right? That offers us a totally different lens. And not to say that we aren't also doing that. It's hard to do that in those moments where we're feeling frustrated, disappointed, right? That is like a prefrontal cortex thought. um, but those behaviors are often what we rely on. Under the surface, there's a lot more to be said, right? Under the surface, the things that support these behaviors are these larger narratives, right? So we're talking about themes and ideas and stories that are really rampant, that really show up in our cultural stories, right? So I mentioned like stranger danger earlier. We talked about, like, I saw some head nods and we talked about that, like, oh yeah, I remember hearing that when I was a kid and being told, like, hey, don't talk to that person, or like, don't share this information with people, and blah blah blah. And so that was like a pretty significant cultural story in the US for a while, right? Especially when it came to safety and child abuse. Was like, don't talk to strangers, don't give people your personal information. Strangers cannot be trusted. People who are different from us are strangers, and we don't know them, we don't trust them, we don't engage with them, right? For a long time, this was a story that probably a lot of us were familiar with. And underneath those narratives are these mindsets, right? The mindsets are like the bottom part of the iceberg. They are these really deep and assumed patterns of thinking that shape the way that we see and make sense of the world. And I don't just mean that these are my mindset or your mindset, right? These are like cultural mindsets. These are worldviews. These are perspectives that show up in every facet of the world around us, right? When you're consuming media, you are constantly being shown the world through one of these mindsets, right? Whether it's yours and you're like, yep, this tracks, or it's most notable when it's not yours, right? And you're listening to someone tell a story, or you're watching a news story, or you're reading a book or whatever, and you're like, why are they thinking about it like this? Like, that is so off for me, right? This is not aligned with the way that I see the world. These mindsets are most visible, right, when they're put in contrast with yours, right, or with someone else's. So let's talk a little bit about the mindsets. So if a mindset, right, that gets in our way around child abuse prevention is the inevitability mindset, right? Child sexual abuse is inevitable. There are just bad people out there who want to hurt kids, and the best we can do is try to catch them and stop them, right? I think that is a mindset that a lot of people hold, right? I do this work all the time. I have done this work for a while, talk about it a lot. There are still people in my family who hold this inevitability mindset, right? Because it is really deep and ingrained and baked in. Um, and that mindset fosters these narratives, right? Okay, well, child abuse is inevitable. There are bad people out there who want to hurt kids, and we just have to catch them. That also means we got to try to stay away from those people, but we don't know who they are. So stranger danger, right? Avoid strangers. Um, we have this also this kind of bizarre belief sometimes, I think, in our culture that perpetrators are very sophisticated, and they can only be identified by law enforcement. I feel like these myths kind of get busted sometimes. So people who are interested in like true crime media, right? Where you're like, wow, they were actually being really obvious, but nobody investigated this, or this wasn't a priority. So they actually didn't look into this issue any further. If they had, they would have noticed that this person had been doing this for a long time. But it's really easy for us to get caught up in this idea, right? And if we really believe that the only way to stop abuse is to stop the bad people who are causing it, and that those perpetrators can only be caught by detectives or police officers or prosecutors or whoever, well, I can say, well, I'm not a detective, I'm not a prosecutor, I'm not an attorney or a judge or a police officer. So that's a shame, but that's just not my job. There's not a role for me there. And so our behaviors, again, are fostered from these narratives. They grow out of this, right? We're practicing what we're thinking. We aren't taking risks in situations where we see people pushing boundaries, right? Risk being calling that out, asking people what they're doing, asking other people, hey, did you notice that too? That was kind of strange, right? Did that make you feel uncomfortable, or was that just me? We normalize and kind of allow boundary pushing to happen, right? Um, and especially when we're around people that we know or have relationships with, because we are primed to see abuse as something that people we don't know, strangers who are bad people, mysterious bad people out in the world are doing, and not the people who are close to us or who are in our lives or our communities are doing. So if we flip the script and we look at building out a narrative from let me say that again, from a prevention perspective, right? From a world where children's safety and well-being is centered, our mindset is going to look really different. Even just one person can make a difference in keeping kids safe. My voice matters, my actions matter, because child abuse is preventable and there's something that I can do to protect kids. I'm not saying deputize yourself or put on a cape and go out and put yourself in dangerous situations or at risk, but practicing working from this place. These mindsets foster new sets of narratives, right? All of us can make a difference. And actually, most people want to keep kids safe. When we have more information, we can do more, right? When we know better, we do better. And we have the opportunity to model for children how they deserve to be treated. So when we are setting boundaries, right, or identifying boundaries that are being crossed and holding them more firmly, it's not rude, right? It's modeling those proactive safety behaviors. And lastly, those behaviors show up as verbalizing and normalizing boundaries, talking about consent and safety and bodily autonomy, speaking up when you see something that is concerning, where there are concerning patterns of behavior, right? Paying attention to those behaviors and saying something, I'm going to say especially, right? When those boundary violating behaviors, right, or concerning behaviors are done by people in positions of power. That's a really hard risk to take sometimes, but it is often a very important one. So we're going to switch gears a little bit because we're getting close on our time and talk about the community work of prevention. So this is where we are addressing those upstream risk and protective factors, right? Community and societal risk and protective factors through change, through environmental and policy change. And I don't mean environmental change like planting more trees, even though that it would be very nice. I'm talking about the environments, the spaces where we spend our time, right? Where we live and work and play and learn and grow and socialize, all of those things, right? So our workplaces, our schools, our homes, our houses of worship, our parks, our wherever you like to spend your time. So feel free to toss these in the chat as well or come off of mute. What would you all say are some community level, right, or society level risk factors for child sexual abuse? I see in the chat lack of awareness. Absolutely. What else comes to mind? Lack of willingness to speak up against other adults. Lack of, oh, there's so many coming in. Okay. Stigma preventing discussion, lack of policies to protect, perpetuation of myths like stranger danger. The what if I'm wrong? Absolutely.
I was gonna say sometimes like the physical spaces, that have discrete corners, or hidden spaces.
Absolutely. So like we're in an environment, right, that is conducive to like secretive things happening, right? Or like there's lack of supervision built into the environment, right? Because it wasn't designed with a safety perspective. It was was designed for whatever its initial purpose is. I'm seeing, oh, there's so many good ones in here. Okay. Lack of knowledge on adults who work with kids noticing the signs. Yes. Whether or not background checks are conducted for adults in care of children. Being raised in a hope where corporal punishment and verbal, I'm going to say in a house maybe, where corporal punishment and verbal abuse was normalized and hard to see. It wasn't okay. And is it now? Ooh, yeah, home. Okay. In a home, not wanting to be the person to speak out. Oh my gosh, you guys are nailing so many things. Normalization of internet access combined with lack of knowledge on how to monitor. Oh, Boanne, I want to give you a megaphone for that one. For sure, right? And that doesn't mean internet access is bad, right? We access a lot of, you guys are doing this on the internet. We're doing this on the internet right now, right? You can learn a lot. You can connect with people. There's a lot of value. We don't give kids the tools to use it safely, assuming they're already receiving help or someone else is aware or helping them. Oh my gosh. Okay. Keep it coming in the chat. This is really great. I'm going to throw a couple slides or a couple risk factors on here too. And I'm going to zoom out even more, right? Poverty, lack of employment opportunities and access to a living wage, housing instability, eviction, homelessness, lack of support or oversight of youth spaces, general tolerance of sexual violence within the community, weak community sanctions against sexual violence perpetrators in the community, and other forms of community violence. If we're zooming out even more, right, we're talking about maybe the whole country versus like a community. Societal norms that support or normalize sexual violence, societal norms that support or maintain gender inequality, negative attitudes or beliefs against identity groups. These would be your general isms, right? We're talking about racism, we're talking about sexism, we're talking about ableism, we're talking about homophobia, we're talking about xenophobia here. Weak laws, policies, and responses to sexual violence, and high levels of all forms of violence. When we normalize, right, that violence and deprivation are how people live, and that's just how it is, right? We normalize the inevitability of that too. It makes it really hard to get out in front of violence prevention in a way that really matters. Because in terms of bang for your buck to prevent violence from happening, we could all of us be hustling, talking to every person in our community, right? And if every kid had a safe place to stay, if every family had a safe place to live, if families had access, well, now I'm getting ahead of myself. I'm getting ahead of myself and I'm getting my soapbox. Let's talk about protective factors. What community or society level protective factors do you guys think could prevent, reduce, or buffer against abuse? An educated community.
Maybe background checking in addition to other things.
Sure. So talking about more requirement on background checking in organizations. Jamie, not to put you on the spot, could you tell us a little bit more about what you were thinking when you were thinking educated community? What kind of education
So
are you
education
envisioning?
on this, what we're talking
Oh,
about,
sure.
for sure. But I do think there is that idea that, especially in some of our more rural communities that we talk to, that have sort of that idea of being uneducated, like they maybe didn't finish school or whatever. I have seen
Sure.
more kids referring to what I said earlier about when I'm talking about corporal punishment and how that's not okay. And I see kids' faces that are like eye rolling and like, oh my gosh, who's this lady? It's like,
Yeah.
you're probably being abused. Um, so it's a lack of education that these things are not okay, but I think it also does come with that generalization of, the poverty, uneducated, the people that just don't. But I think as a whole, it just needs to be community members who understand what we're talking about,
Absolutely.
what exactly we're talking about, as being forms of abuse is, I think, the most important part, more so than the
Yeah.
idea that they're quote unquote uneducated. Like,
Yeah.
I have seen people that didn't finish high school that have a lot more sense in this area than people who have gone to school and think, oh, well, since
Sure.
they're a really wealthy family. So, I mean, I used to work at a learning center that for wealthy families, and they're like, well, good thing we don't have to worry about abuse here. And I'm like, okay, just because they're
Sure.
making six figures a year doesn't mean they're not capable of abusing their children. So,
Yeah. Thank you for sharing that, Jamie. I think there were some, like you said, we're already kind of pulling the thread on some of these kind of like misconceptions or stereotypes about abuse, assumptions. But I also was curious to hear more about what kind of education you were thinking about. So thank you for clarifying. I'm also seeing in the chat open communication around these topics, stronger policies and laws, safe workplace guidelines and protocols, mandate reporter laws, and following through with them, and then a big smiley face. Some of the other pieces, right, that show up here, there's a lot of some of these are harder to measure, right, or harder to kind of envision and conceptualize, but there's a lot of research that shows that social cohesion and connectedness is a tremendous protective factor against all forms of violence, especially against child abuse, right? Um, Accountability and community sanctions for perpetrators of sexual violence. You guys were talking about this. Schools and youth survey organization, policies and practices that center youth safety and well-being. We were talking about guidelines, we were talking about background checks, we were talking about policies, physical environments that promote visibility, safety, and connection, right? You guys were on this on the last one. And then zooming out again even more, access to um, jobs that pay livable wages, right? And financial supports as needed, access to safe and affordable housing, access to quality, affordable childcare, access to mental health care and substance use treatment, comprehensive sexual health education. We see a lot of these big societal risk and protective factors that have a tremendous impact on the the rates, the prevalence of abuse victimization and re-victimization. So talking about how we roll these things out at that community level can feel a little daunting. It can feel it's less concrete, right, than rolling them out at the individual or group level. So a few ways that folks can engage in these practices, right? Participate in social norms change campaigns in our communities or statewide. So some of you might be familiar with the Something We Agree On campaign that the Children's Trust Fund rolled out a few years ago, where it was a purpose-built social norms change campaign that was designed to educate parents and caregivers that talking to their kids about preventing sexual abuse is, like they said in the campaign, something we agree on, right? That it is popular and common. They did huge surveys of parents and caregivers around the state and found that the vast majority, I want to say 85%, said that they think it's important for adults to talk to their kids or for parents and caregivers to talk to their kids about preventing sexual abuse, right? So showing people, hey, if you're doing this, other people are too, and there are resources that exist. What you're doing is really important. It's valuable in your community. And the idea is to shift the way that people consider and think about these actions. Assess the policies, practices, and environments for safety in the places where you live, learn, work, worship, and socialize, right? So we were talking about organizations, right? Are there spaces in the youth serving part of your organization where you know stuff like, right? If you work at a school with a playground, you know where on the playground is a blind spot, right? You know where in the building is a blind spot, and the kids do too, right? Advocate for policy changes, right, that address those risk factors at the city and state levels, like in your communities, and advocate for those policy changes on that promote and enhance protective factors at the higher city and state levels as well. So there are a few resources. I'm trying to keep an eye on the time, so we have at least a couple of minutes to chit chat after. There are a handful of resources that will be shared with this afterward, including some of the tools and documents that like supporting materials from this training. As well as we will be sharing out more materials about how to roll out and utilize those core prevention messages in your community as well. So all of this will be available to you, as well as the recording after the session. And for folks who are on, who have registered for our prevention skill builders, you all will have the first access to those new core prevention belief materials as they become available. Oh, okay. This is in here twice. Feel free to continue it. We would love to have you all continue attending. If you aren't able to participate live during the webinars, they're always recorded. We're going to go ahead and I'm going to pause and wrap up here. And I'm going to, I thought I had a link for you guys so you don't have to do it on, there we go. I have a really brief evaluation, so feel free to, if you have a minute, we would love your feedback. But I also would love to continue chatting if folks have questions, if you have thoughts, if you have curiosities about how to bring the prevention messaging or any of the models that we used into your prevention work. Please feel free to bring those questions here, or feel free to mull on them and reach out. We want to begin kind of fostering this larger scale conversation about how to embed these messages in the work that we're doing across the state, and how to make sure that all of us have a network of support and resources that we can rely on as we're doing this work that can be challenging, and can also sometimes, you know, feel hard to do in a silo. Oh, Jamie, I see your question. How do we access the previous recordings? So they are all, excuse me, they're all hosted in the MO-NACA Coalition Manager. I can send you guys a link to those. And if you are if you register for any of them, you'll have access to the recordings as well. So they'll get sent out to people after the trainings too.
I'm
Probably
trying to
on
get the link
Monday.
pulled up for everybody, but my computer's just
Thanks,
going very
Randy.
slow. I think it's on Zoom. So
If
I can
not,
get
we
it
can
for this
also
and
send
I'll
it.
drop
Oh,
it.
here, let me close this so that if folks want to talk, we can see each other. We'll get that to you as well. I know it can be tricky. So we'll send you the link to that that the resource manager page and coalition manager where you can access all of those materials from the previous session, and this one will go in there too, and everyone will have access to those links moving forward as well.
I have a quick question. I
Yeah.
would consider myself still kind of a new professional in the field, and I feel like I think I get a lot of information, read a lot, and I'm exposed to a lot of information, and so I feel like sometimes I'm like know a lot, I can share a lot, but sometimes I struggle to get that information out to people. And I know at the beginning of this call, someone brought up like even if you do host some trainings for the community or try to get a group, it can be hard to get those numbers there. I mean, some things we do, we have like brochures we hand out at school, school activities and stuff. I don't know if you guys have any other tips, or advice in general
On
for how to
getting the
take action.
materials.
Yeah.
Yeah. Yeah, that's a great question. And Emily, I think that's probably a question that all of us on this call are thinking about. And I can tell you for sure that Randy and I have been talking about a lot. Um, it's like once you have the information available, how do you make it accessible to people, right? Um, and so we've been talking a lot about using social media for messaging. And the tough part is, some of our organizations use social media, some of them don't, right? And that's okay. Or some of them have a following, some of them don't. I think getting creative about the ways that we want people to consume the information can be really helpful, right? Like, I think short form video is a medium that a lot of people are using to consume information, right? Whether for better or for worse. I think we're also learning what it does to our brain and our attention span, right? But if people are going to things like TikTok or Instagram Reels, right, for information, right, and they feel comfortable accessing information in that way, those can be ways for us to share our information as well, right? And you don't have to be an influencer and have like a whole setup. I know Canva is really helpful for putting together like visually appealing graphics, and you can make videos, video structures in there. I think that the one of the challenging parts about this work, right, is that we become experts in our content and our material. And we could be so good at talking to folks about it. And the hard part, right, is that if we can't get in front of people, it's really hard to do that messaging. And so I think this is as a field, we're kind of having to learn and stretch into this area where we're learning a little bit more about like marketing, right? Or it feels weird to say marketing when we're talking about child abuse prevention, right? But we're learning how to reach people in different ways, because the information ecosystem is there's so many pathways to it, but it's also really saturated. Like anyone with a device can become a messenger, right? So how do we make sure that we are reaching people in a meaningful way, that we're doing those things, that we're being empowering, inclusive, impactful, and actionable, that we're meeting people where they're at, that we're giving them multiple on-ramps. And I think there are it is a challenge, and I think that I know prevention consultants, like you guys are doing it. Like Linda told me about the podcast that you guys are doing. And so you guys are already exploring different pathways into that information ecosystem, which I think is huge. And sometimes it takes a while to build up the following or the platform to feel really comfortable using it, to feel really comfortable doing it regularly. It is time consuming. Whether you're making videos or making social posts or recording a podcast or writing a blog or whatever, whatever the the pathway is, it does require like time and resources. And I think those are often second thoughts because most of us are not full-time communications people. Um, Again, we are wearing many hats. So that's like probably not a satisfying answer to your question, Emily. I'm going to be totally honest.
No,
I
no.
think that it's a place that we're all trying to kind of learn and grow from. But I hope that it's the beginning of a bigger conversation for kind of our prevention network in Missouri too.
Yeah, for sure. I think things just do take time, and that's the hard part
Yeah.
for professionals is understanding, like, yeah, even the following or getting people to interact more, and probably goes into the part that you mentioned about trust. Building trust takes a lot of time too. So no,
Yes.
I do
And people,
appreciate what you're
yeah.
saying. Thank
Well,
you.
thank you.
And
Any
Emily,
other,
one other thing to what Kiki was saying, like a route to get to the parents. Some schools have like electronic flyers, and
Mhm.
so like if you have an event, it might be that they can your school can share it, and the parent might not be able to attend, but they might start following you on social
Mhm.
media. So like making those little bridges, but just like using the if the school in your district has those social media flyers. I know my local school does, and they share things from outside of the school district, but that's for parents. That's an avenue too, and it might lead. Hopefully, they come to your in-person event. But I also am a busy mom with kids have sports and stuff like that. So you have two routes there. That you might give them at your event, but you might also give them to follow you on social. So you might be able to grow that in that aspect too.
That's a good point.
Absolutely.
Yeah, thank you.
And I'm sure there are different platforms, but the most of the districts in my area use a tool called Peach Jar. And so you can use that and submit it to the schools or to the whole district for their approval, and then they can make it available to the families. I know we have a couple of school district folks on here, so if there are other helpful recommendations, feel free to pop them in the chat or share them. All right, it is after 10:30. I really appreciate everyone's interest today and participation, your questions, your thoughts, your ideas, um, your willingness to go on this winding path with us and talk about trust building and communication and risk and protective factors. All of this will be available to folks afterward as a recording. Please don't hesitate to reach out if you have questions or thoughts, or if you have ideas or topics that you would like to see covered in future skill builder sessions. All of these topics were identified based on previous requests for resources or information. And so please know that we are really, really open to that feedback and excited to create and develop more resources and access more resources that are helpful and supportive to you all. So thank you again for being here. We can go ahead and stop the recording. If folks have any other questions, feel free to stick around or hop in the chat or email us after the fact. I will Yes, you should have our contact information and we'll make sure that you guys get it in the follow-up email as well.